the Rainbow Show with oh 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 great. Where are you? Come on, with resist. Wait, you gotta be quiet. Here we go. No, there we go. Resistance is fruitful. This is Jonathan Barnett, and today we are going to have a jolly old time.
Like I said, I've been in this community for three years, and yesterday was my last day officially as on the moderation team at the website Questioning AIDS. I do still identify as a dissident, as that kind of a bigger umbrella of people who are questioning or skeptical, and there's several factions or schisms in this community. I think it's very healthy to question the mainstream view about AIDS. I think it's dangerous. I think it's damaging to gay men. I think to have advertisements for drugs saying, here, take this pill once a day and you don't have to worry about getting AIDS is a mistake. And it's avoiding the conversation that we as gay men need to have about what is and is not healthy. And so I'm a questioner. I'm going to self-identify as a dissident regardless. I don't like seeing what I see about this sort of litmus test around ARVs. I think the drugs are, I've made this clear a couple of times, that they're not, they're a last resort, but I'm glad they're there. I took them because of, I tell that story elsewhere, and I don't want to get too far off on that. What I'm seeing in the dissident community, I mentioned that I broke away from the mainstream point of view because it wasn't adding up, it wasn't working, they were being dogmatic, and they still are. I'm writing a blog post right now about what I'm doing with the ARVs, but there's this, and it's not everybody in the dissident community at all. It's just but I see it as sort of the dominant thinking that if you don't totally discount ARVs, if you don't tell people not to get tested, you're not a true dissident. You're not really a questioner. And I think
that's what I mean. That's what I'm talking about, where it's going a little bit too far.
I think that's dangerous, and I think the evidence is pretty overwhelming that there's some unhealthy things that are more prevalent among some gay men, and that we need to go back and here's what I'm unhappy about or dissatisfied with the dissident community. They seem to be most interested in disproving the mainstream rather than going back. Let's go back to 1981 or 78 or whatever point we want to make it, and identify what was making gay men sick.
I like the idea of meeting the problem halfway when it comes to ARVs and minimizing them. I like what you were saying in one of our chats.
Let me go through that if you want me to.
That much is so obvious. I mean, this is where you should really give advice.
Well, this isn't advice. This is telling my story, and I wish this is what I'm frustrated with. The drug companies control the trials. The federal government is not. They're just in sync with them, and nobody is looking at. The dissidents are dismissing ARVs completely. They're off the table. They're off the table. So I have been dealing with other health issues, and I think I've given a lot of attention to some of the things we've been told to do. I don't just follow my CD4 and viral load, but I do follow them. They're not the only thing I follow, and I'm not ready to dismiss them. And let me show a couple pictures here.
That's what I like about your approach. You take things into. Let me just focus the camera on you, because
okay.
You still take even though they might not mean anything, you still take them into account and get what you can from them. So
I'm going to apologize in advance, because if this seems too professorial, I'm sorry. I don't know.
Oh, go ahead.
I'm a data geek, so I've been I've been tracking my numbers since 1998, and I don't know if I can point here. This is CD4 counts for what, 14 years, and for most of this time, these numbers have just been up and down. They're crazy, but at certain points in 2008 or so, these numbers are like maybe 300 or so. By the orthodox standards, those would be considered low. I didn't worry about it. I wasn't thinking that. They don't bother me. But if you look at around March of 2011 was the starting point, and that coincided with an episode of Bell's palsy and a carotid cyst. Notice what happens towards the end of this 13 years. I'm going to show some other charts, so I'll try to move through them a little more quickly. Okay. Viral load, again, we're looking at a big span here, and for these time frames, the first 10 years.
What year does that start with on the bottom?
1998. Okay. This is December of '98 when I was seroconverted, and here in 2002, you see a little blip here. That was like 30,000 or 40,000. That was big number. Back in and the blue bars represent when I was on the drugs. But look what starts happening here around March of 2010. The numbers really start changing, and the top number goes to 1.5 million, which throws the scale of the chart off completely. So I'm going to, okay, I zoomed in a little bit. I'm slicing down. This is just the last 17 months of CD4 counts. Okay. This is the decline I saw. The lowest it got to was 70. Yeah, this is before I started taking the ARVs. Bear with me, I'm still learning how to drive this thing. This is the viral load in the same time period. Now, they do not correlate exactly. However, they were going from the 6 digits. This is where they start talking about log value. I mean, these are changing by a factor of adding zeros to them, up to 1.3 million at one time. And then it started bouncing around, but it was still, the trend was
when I was in the hospital, because I hadn't gotten tested in so long, I was at 10 million, my viral load. Oh. And when I was first sick years before that, when I was equally sick, not as skinny, but I was only at 500,000. So that was another thing. Is this test measuring a viral load of HIV, or is it measuring the level of infection that might be going on in our body? Is it a general protein measurement?
Well, let's step aside and talk about that for a little bit. I can come back to where I'm going after the drugs. Okay. Viral load is, the mainstream view is this is counting some segments of the virus, and this shows how much of that virus is in your system. Dissidents disagree and say that it's. There's no one thing that's said. The inventor of this test actually has dismissed it for diagnostic purposes himself, Kerry Mullis. But it's something, and so the most common thing I hear is it's cellular debris. And that seems reasonable to me. I can go for that, because I had these other things happening just before this. I got Bell's palsy. This whole side of my face dropped. Right. I got a lymph node, parotid cyst that got about the size of a golf ball. And so those things could be throwing off a lot of cellular debris. What's curious, and this is where, now I'm questioning dissidents as much as I question orthodoxy. Right. The ARVs are allegedly, according to this is dissident wisdom now, ARVs are cytotoxic. They are DNA terminators. They kill everything, Yeah, they'll cure the disease, but they'll kill the patient when they do it. There's two trains of thoughts. In the dissident community, there's rarely just one train going anywhere. There's usually a whole bunch of them going everywhere. So one side says that it's a DNA chain terminator. I think that's Duisberg's point of view primarily. Then the other big camp, Perth group, says, oh, no, there's not proof that it's a DNA terminator, but they do damage they do mitochondrial damage. Either way, you guys can go ahead and continue to have your scientific debate as a patient, as a person who's dealing with these, as an affected person. my question is, if these drugs are so damaging to cells and are just indiscriminately killing cells, why does this marker of cellular debris go down when people start taking ARVs?
Right.
Because that's what we're going to go to next. This is after the red line is when I started taking ARVs. This is viral load.
Okay.
It was up, around 1.5 million. Those drugs in in about a month just knocked it down to not undetectable. The first number is 4,100, but it knocked it back down. So I'm like saying, I know I'm a layperson. I know I'm not a scientist, but you're telling me this is a measure of cellular debris, and these drugs.
Well, they're not scientists either, so.
Well, some of them are. Some of them are. So that's a disconnect to me. I do not know. Let me make it really doubly clear here. I do not know what this PCR RNA is.
Well, because I'm still open, it could still be. It doesn't have to be HIV, basically.
No.
It could be something. I mean, a measurement that catches, say, my MAC infection, that also catches something that's going on within you. Something's going on is the point. So I think the great thing about what you've done, the fulfilling thing. I don't think it's great, but it's fulfilling that you take your own situation, we take our own situations, and we try to learn from there. Because if we try to look outwardly to what's going on in the general public with HIV/AIDS or with the idea of immune deficiency, it's going to make it's blurry and it's confusing. It's going to make it more tough to do it that way. So it takes brave, somewhat intelligent people to kind of just look at their own situation, maybe try to unravel and figure out what's wrong.
Right.
Exactly. What can be done?
Well, I want
what can be done.
I want to find a new community. I want to find a community of people that's looking for the answers to why these surrogate markers that are supposedly meaningless change the way they do. And I'm going to go ahead and just quickly show the CD4 since the drugs, because that's viral load I don't really care about. If my CD4s had not declined in the viral load, I would not have started the drugs. I did not start the drugs because of the viral load. I did because my CD4s were plummeting, and I don't buy the argument that they're meaningless. So this is the other piece after the drugs. The CD4 is not responding quickly, but the decline has stopped. This little red dot if you can see me here, where they dipped. Actually, that was the test taken in the hospital when I was in there with shingles. Right. Now I find it kind of interesting when I get a viral infection that your body's supposed to mount a response that the CD4 actually dropped. So then for those who might be watching who dismiss those two markers and say, I've been accused of being, you're focusing on meaningless surrogate markers. These mean nothing. Okay, fine. Those are not the only things I follow. Right. You are the one who's fixating on them. I actually do a lot of things, and I'm going to try to bring a whole bunch of information together short. Organic acid tests. These are tests of your urine. They don't draw your blood. You pee in a cup, and they measure metabolites. This is an incredibly helpful test. This is 5 tests over a period from the end of 2010. I get these down at my orthomolecular doctor. There's 72 markers. According to these tests, I had fungal and bacterial overgrowth in my gut. I had unbalanced neurotransmitters. During these first 4 tests here, I was doing intravenous vitamin C, ultraviolet blood irradiation. I was making a little bit of an effect, but here's 20, 23, 19, 21 out of 72. That's what, a third or so of these markers are out of range, and they were sending a strong, loud message that you've got problems in your gut, and it's fungal and bacterial. After the red bar again is the ARVs.
Yeah, I don't recall having that test, but I'm pretty sure I had a lot of growth going on there.
You'd have to find somebody that's outside the mainstream. I mean, my family doctor, I love her dearly because she's extremely accepting, and she's very curious about these. But and if they are covered by Medicare, so I assume they're covered by most insurance, and they're very revealing and informative. The point being, they changed those numbers when none of these other things were. So
yeah, well, I understand the dissidents, the hardcore dissidents are, you know, saying you're a sellout because you might seem a little bit too dependent on those numbers, but again, you're not just looking at those, you're taking everything into account.
I'm trying to. I mean, I have a whole hard drive.
As much as you can.
And I don't just go to AIDS doctors. I go to an orthomolecular clinic, and what's hard for some people to understand. You know, I've been fighting a cough for 2 weeks now, and I finally went to my doctor today because I could go to a holistic doctor, Chinese doctor, acupuncturist. It's going to cost me $70 to $100. If I get herbs, that's another $50, $60. I have insurance. I can't afford to live in this world without insurance. So that sucks. But it is also a fact of life. And a lot of people fighting with poor health are poor. You know, they can't rent cars. They can't rent cars and drive 4 hours, spend the night, go to a clinic, and incur. Go ahead.
That's what I was trying to say before. I kind of felt like the conversation was, is it a gay or straight world, or are the problems the gay or straight problems? Are they gay or straight problems? But it's really have and not have world. When you want to look at what's going on and the effect and cause and effect of everything, it's yeah, it comes down to that. It's a classist issue. It has nothing to do with race. It has nothing to do with sexual orientation.
And anybody that knows me will know that resorting to drugs, to ARVs, is in my mind last resort, because I was so messed up by 2006. I had been prescribed 24 prescription drugs. And look at some of those. Human growth, RHGH is human growth hormone. That was, I was on compassionate use. That was $1,000 a month. Provigil.
Damn.
Provigil, which is when I got the generic, it said
Celebrex,
amphetamines, Celebrex, Effexor, Klonopin, Vicodin, Actos. I quit all of them in 2007, and that's part of my. None of those were HIV drugs, right? You know.
But that's where I drew the line. Like when I started taking, like, because ARVs make your cholesterol go high. Now I need a cholesterol pill, and I said no. Thanks for telling me my cholesterol is high. I'll do what I can to balance it out with, by avoiding certain people, and I did. But yeah, it's going to be one drug leading to another. Oh, your cholesterol, because I know what would have came next. Your cholesterol pill is making your sodium level go.
Right.
This now take that. Get the hell out of here. I could, we do. The important thing is we have the. I mean, it might not always be easy, because I was talking about that emotional weight that some of us have, or some kind of mental blockage going on at certain times of our lives. But it feels good to know that maybe there is no magic solution, no magic potion, no magic food, but all around, we do have some say in our health. So I'm trying to focus on that at least, and see where that goes. But you have too, you in your own way. I mean, I'm glad you've tried what you've tried, because I wouldn't have never tried the vitamin C's. I would have never tried the.
I had help. I had help from. I hope if they're listening or watching, I hope they don't take offense. I have sugar daddies, I have friends who have been willing to help contribute financially, so I can do this, because I part of what I'm doing, why I'm doing what I'm doing, documenting, is I don't know what else I can do.
Yeah.
To somebody, maybe somebody can make some sense of this, and why is our dissident community, and let me, I don't want to diss, but I also think people need information. The leading organization in the AIDS dissident community has raised and spent almost $250,000 over 4 years. On what? Where is the record tracking for people doing these things like I am? Where's the system for analyzing this data and seeing what we can gain from it. Can I go on to the next and last piece of this, because I'm trying to write a blog post and it's very difficult. You are getting a coup here because this has not been publicized yet. I've been on these ARVs since May, and people think, especially some of my dissident friends, assume that I'm taking highly active anti-retroviral therapy. I'm taking a 3 or 4 class cocktail, that I'm taking a tripla or Truvada or something, and I'm not, because I am so horrified of these drug combos. I did my own research. I've been in touch with people in Europe, and there is I went to the Mayo Clinic, and on the left is the recommendation for the heart cocktail they recommended for me. And the top one for Zista is protease. The first 2 are protease inhibitors. I forget what Icentris is called. It's one of the newer drugs. The Absicon is NRTIs, non-nucleoside reverse transcriptase inhibitors. These are the drugs. This lamivudine is a relative to AZT. This little pill on the bottom is the killer pill. This is the one that has everybody so upset about being a chain terminator or mitochondrial damage. And I'm not saying these other drugs do not have damage, but all of these in combination have an effect other than just the reducing the viral load. On the right is what I'm actually taking. It's called reduced dose or low dose boosted darunavir monotherapy. The top pill is darunavir. It is based on a natural substance found in fungi. It's a natural protease inhibitor. The Norvir is also a PI, and it's not a very good, it's not a healthy drug. It's got some bad effects, but it's a booster. Notice the dosage on the Norvir is 100 milligram. When it was first came out, I believe they started at 1,600 and then 800. So what I'm trying to get across is that the dosages have been reduced, and what I'm trying to accomplish is what is the toxicity level of these 2 regimens? How much am I reducing my risk of liver damage and failure by not taking the chain terminator / mitochondrial damaging drugs, and not taking full doses? I'm taking a half dose, and this is what they did.
Right.
Half dose monotherapy knocked the hell out of that power load. It is stop the decline of the CD4. Whether you believe in those markers or not is irrelevant. What is important, and what I want to share, and I'm pleased before anybody do this, you talked earlier about the control thing, that when you start going to an AIDS doctor and you start getting assistance paying for these drugs, they control you, and that is a fact. That is a problem. Yeah. Don't do this unless you are prepared. You have support. You know. I don't know what I'm doing. I know I'm taking risks. But here's what pisses me off about mainstream AIDS, the system, is that they want to insist that we all take these fistfuls of pills when it's not necessary. And I'm going to stop and let you talk, because I get going too far.
Yeah.
Let me say this though about what I'm doing for those who are watching and listening. Do a search, Google darunavir monotherapy. There have been trials for over 3 years on this protocol. Not at the level I'm doing, but they know in Europe. This is in France and I forget now what country in Europe. No problems with resistance. Extremely good results with this. They know this, but do you see pause.com or AIDSmeds.com advocating that maybe if you feel like you have to do this? And I said I was going to stop, and I'm not. This is what I'm doing. I have other friends who are taking their AAA every other day, every 4th day. I know people who are doing all kinds of intermittent and interrupted treatments. And I'm like you, John. I don't know when. I don't know how to know when to quit them. I am going to quit these drugs again. I don't plan to stay on them. I'm not going to.
Well, my first round with them, I was put on 5 pills. I mean, this validates what you're saying. What was it? Atripla, which is a 3-in-1 pill, and then 3 more on top of that: Norvir, Rayataz, and I can't remember what the other one was. There's something else. There was something else in the mix. So little by little, I started realizing, because of course it's a 3-drug cocktail at least. So why am I on 5 or 6 pills? And so I said, this doctor's never going to tell me to stop taking all of these pills. So it was my doctor never said stop. I stopped, and within that 2.5-year range, I continued to test my CD4 levels and my viral load, and with just taking the Atripla by itself, my viral load was fine. My CD4s went up to about 500 something and stood around there. And the second time around, I was put on a different regimen, of course, even though I was supposed to now be immune to them, but he had me on them anyway, Rayataz and Norvir, now with Icentris and Truvada. The Truvada is, I think, 2-in-1, and Icentris is a 1 pill. So that's the only thing I need to really be taking, according to common sense. So after 2 months of being in the hospital, when I came home, I stopped taking the Norvir and I stopped taking the Rayataz. And my viral loads continually went down, and my CD4 has climbed up to about 400 something now. So, and I'm just 100. My viral load is 100, which is like 80 points from undetectable, or 50 points from undetectable. That was back in November was my last test, which was only 4 months after me being really sick and starting the pills. So, it validates what you're saying, and then it's making me realize, hey, I am going to stop taking them altogether. I don't look forward to testing out the minimal damage. As you know, my goal is to figure out how I could best take care of myself without them.
Well, and that's another reason we're not seeing the pharmaceutical companies fund the research for the most part, and there's no incentive for them to find to find ways to reduce the number of pills that a person is prescribed. I think they have reacted by lowering doses. I think it is in their interest to reduce the toxicity. I mean, they don't get it. It's to their advantage to do that. So they have been reducing the doses. But this idea of heart and that you said it, but I want to emphasize it too for anybody facing a positive diagnosis. Don't how do I say this? Yeah. Question whether or not it really is wise to start taking these drugs just because you get a positive test result, or if you're feeling healthy, there's nothing else wrong with you. The doctors are going to tell you you're better off starting early. What happened to that was what they told us in '98 when I was tested positive. Hit it hard, hit it early. Then the guidelines, quote unquote, big capital T, capital G, the guidelines said no, the risk is too great. What has changed that and they're going to say the drugs are better and improve. Well, that's just silly. The new drugs are just, so many of them are just all the drug cocktails and have to, for the most part, include 2 NRTIs, and those are old 15 and 20-year-old drugs. They've just been recombined. So that's the skepticism I have about the mainstream. I've already told you I have skepticism about some of the dissident memes, and so I told you before, I'm finding myself